welcome to the Facebook Live. I'm sorry we are a little bit late. We had a little bit of technical issues, but I think we have sorted it. So for those of you that are online now, we just really appreciate some thumbs up, some hearts. Let us know whether you can hear us or not. We're really, really excited to have Candice on today. Candice is a veterinary nurse. She's based in Rivonia in Johannesburg, and she has specialized in rehabilitation. And she has a clinic. I'm going to let her talk all about that because it's really exciting. She's recently just opened up. Before that, she was sort of doing a mobile clinic. And she had a case, which was a really challenging case for her, that she really wanted to share with all of you. And I thought it was a wonderful opportunity to chat to her about what she does. And the little doggy that she's going to be talking about is this little doggy here, Teddy. Look how cute he is. Welcome, Candice.
Hi, everybody. Hi, Megan. Thanks for having me here today.
Candice, we're waiting for a few people to come online so to give us a thumbs up. So I see someone's on there. Can you give us a thumbs up? Let us know that you can hear us. We've had a few audio issues and struggling to connect. So somebody is there, so we'll just wait for that. In the meantime, Candice, why don't you start telling us about your clinic that you just opened? So exciting. Just let us know sort of your path from when you finished veterinary nursing to where you are now.
Yeah, so I'm very proud to say that Ramsay Rehab is open in Rivonia now, which is super exciting. I have a beautiful clinic right next to Rivonia Village Vet, which is great. The vet is right next door. But it was a bit of a journey for me. I started my rehab journey in about 2015, finishing my CCRP. And after that, I ran a mobile business until very recently. It was pretty successful because, visiting clients and patients at their houses is an invaluable way to treat patients. But unfortunately, as a practitioner, it's not sustainable. So I decided to open my practice, and most of my clients now come to me, which is fantastic. I have a beautiful garden area where we do active exercise. We've got access to all the modalities that we need. So it's really great, and I'm able to make the quality of life difference for my patients and look after myself, which is a dream come true for me.
Yeah, it's much different being in one place than being on the road all the time.
Yeah, exactly.
I've recently done a podcast actually with Candice, and Candice shared all her advice and tips for therapists all over the world how to run a successful mobile practice. So, and there are lots of challenges. So, we have more people online. Thanks for joining us.
Hi, guys.
Just give us a thumbs up so we know that you guys can hear us. I see they're still there, so hopefully they can hear us. No one's given us a thumbs up yet. Leave little hearts to let us know if you're there.
Come on, guys.
So we're going to be chatting today about a case called Teddy. And Candice, I'm going to let her introduce all the information about Teddy and Pat from the very beginning when she first met Teddy. And then we're going to chat about all the ways in which she helped Teddy and just the ways in which veterinary rehabilitation therapists, how they work together with vets to improve outcomes, especially in cases like Teddy who fractured one of his front legs. So do you want to start telling us about Teddy?
Yeah, fantastic. So Teddy's a little toy pom, and he's an older dog. And unfortunately, he had a dog fight incident where he fractured his front leg. It was an area just above his elbow, so it was a pretty tricky area to fix. It was fixed very successfully using a surgery, and really struggled being an old dog. Of his bone wasn't so good, and we often find with these old dogs that they do struggle to recover from surgeries and things like that. Dogs develop more support, like us, things like that. He had all those problems.
Can you hear me?
Hello, can you hear me now? Hello.
Yeah, we're starting with our audio a little bit. There seems to be a few issues. It's going up and down a little bit.
Okay, can you hear me now?
Yeah, you're good now. You're good.
There we go. So as I was saying with Teddy, he's an old dog, so the integrity of his bone wasn't so great. His surgical repair was very successful, but his post-op management was difficult because most old dogs have arthritis, they have other problems, and so we had a lot of things against him. And he was reluctant to put his foot down. So it was almost as if, because of all the trauma in his shoulder and the spasms, he really struggled to use his leg again. So we had to do a lot of what we call proprioceptive exercises. Proprioception is the awareness of where your limbs are in space. So for humans, it's kind of like when you walk up the stairs and you don't know how high to lift your foot. You know how high to lift your foot, but you don't actually have to see the step. That's proprioception. So we had to like re-educate him a little bit with that. And because he didn't want to use his leg for so long, we had a bit of a vicious cycle where he wasn't using his leg, and then he didn't use his leg, so he had muscle loss, and then from there we had to build up the muscle, get him to use his leg, and we had a vicious cycle of deterioration. This vicious cycle of deterioration is also often seen in dogs with arthritis in their hips because they don't want to use their hips because they're sore. And then because they're not using their hips, they have that muscle wasting. And it's kind of like a vicious cycle. So it's not just Teddy that had this problem. There's a lot of dogs out there that do struggle, and you just don't realize because they've been like that for so long.
Yeah, and I think that owners often just think that, especially talking about the arthritic dogs or the dogs with hip dysplasia, I think that this is just how it should be. But obviously this is where rehab therapists come in. And these kind of cases, you address a few different things. So one of the things you would have addressed, obviously, together with the vet was pain. And then you needed him to start weight bearing again so that you could start building some muscle. So how did you actually get him to start weight bearing again? Because I know, especially with those little dogs, it's so easy for them just to keep that leg up, and they just hop around on 3 legs.
Yeah,
that's the problem. For us, hard if we don't have a leg to use, so we can't hop on 1 leg. But dogs can easily just, especially the little ones, and if they're very light, they can just hop around and run around on 3 legs, and that obviously causes pain in other areas and has a problem in all the other limbs because now they have extra load. So what did you do to get them to start putting weight on that leg?
So what I started with was some basic treatments, and what you can actually do for other dogs is basically heat therapy, and because he was early post-op, I could use ice therapy as well, and that increases the blood flow to the area. It alleviates muscle spasm because he had so much muscle spasm from holding his leg up that his whole shoulder was all spasmed, and that actually caused him not to weight bear even more, so not to put the foot down even more because now everything was tight and spasmed. So I used heat therapy followed by a lot of massage therapy, and it goes a long way, it goes a long way because if the dog's not using its leg and that's the only movement and stimulation that there is in that shoulder for Teddy, it's important to do it.
And tell me, for those of you that are online now, that's little Teddy. That's Candice. So obviously, you work together now with vets. So this is really, really a team approach. If you're now not at the same place as them, how do you work together? How do you communicate with the vets? Does Teddy have to come see you and then go back to them, or do you guys communicate often about the progress that Teddy was making?
Yeah, so how it worked with Teddy is that we actually had a whole team on him. We had his GP, we had his surgeon, and myself, and obviously the nurses and all that at the hospital. But the team approach is absolutely phenomenal in especially Teddy's case. But it's so important in every single case, and that's what I want owners to know is that it's not just going to see the rehab practitioner. It's making sure that your old dog has a geriatric check to make sure that his liver and his kidneys and all that's fine as well. Because you can't have a dog exercising if he's got some underlying, disease that's actually causing the fatigue and it's not, let's say, musculoskeletal. So it's important to know the team approach. In Teddy's case, he had a phenomenal surgeon, an absolutely amazing GP, and how we communicate is so once when he was in hospital, I was treating him in hospital, which is great. I was going there, so we could often just talk, the three of us. But there was a few times that we actually met to discuss Teddy's case because he was struggling so much in the beginning. His outcome was phenomenal once he started to weight bear and he gained that muscle back. But yeah, we communicate regularly with rehab reports, emails, mostly emails and rehab reports, because trying to connect on the phone is very difficult in our industry.
And Candice, what were your biggest challenges with treating him? I mean, he's a little toy pom, and I can remember treating toy poms before. Sometimes they can be a little bit snappy. What kind of personality did he have?
Teddy is amazing. I love Teddy so much. He was a little angel, because I would be doing really things that were really uncomfortable for him. I mean, the massage, he wasn't comfortable, and he would allow me to do it. He's like a handbag dog. So what I mean by that is, like, it's okay. Teddy can walk around and own his arms all the time, which didn't really help the situation. Why should he walk if he's carried everywhere? So that's another thing that was super important in his case, is owner compliance. His owner compliance was phenomenal. Teddy's mom looked after him so well, and she really listened to everything that I said and that I advised, not only me, but the GP and the surgeon. And that's what changed his outcome, was that she was doing active exercises. She wasn't carrying him around. She was encouraging him to use the leg. Actually, I think if you say to Teddy, footies, he puts his foot down now. If he's holding his foot up, we were like, footies, footies, and he'd put his foot down. So it's it's a journey.
Yeah, I mean, because sometimes it actually just becomes psychological. They're so used to holding the leg up that they sometimes not even pain that's causing them. They're just so used to doing it. And I've seen a lot of cases before, dogs that have had fractures, and the treatment hasn't gone well, and afterwards they haven't been weight bearing. And what can sometimes happen is, from them holding their legs up so much, they can actually get what we call a contracture in their joints. And I know that this is something that started happening with Teddy, and luckily he was able to see you and you stopped that in the tracks, because once they get this contracture, then the joint is no longer able to move. And when they can't move the leg, then they can't straighten it to be able to weight bear. And then the muscle wastage happens drastically. And usually, once it gets severe, in those kind of cases, you actually need to amputate the leg, because there's nothing that you could do.
Well,
so luckily he got to see you. So how did you handle that? So as soon as you saw it, you obviously noticed it, and you realized that you actually have to start looking at that joint and trying to get some mobility there.
Yeah, no, well, that was the main focus. I mean, post-surgery, as soon as the specialist surgeon gave us the go-ahead, we started with passive range of motion, encouraging him to let the leg actually hang lower. And over time, it hung lower and lower, and eventually he put his foot down. I mean, it took time for Teddy, and that was what we were all worried about. Amputation was the next step, inevitably. But with the team approach, we were able to avoid that.
And he also had some. You were worried about possibly some neurological damage,
yes,
weren't you?
Yeah, so, with the fracture being a traumatic fracture, there was some ripping of the tissue. So it was very hard to see what was actually affected. The brachial plexus and all the nerves in the front limb is full of nerves. So, we were worried, because it was like a ripping injury, that there was more trauma than just the fracture. And because he struggled to weight bear, we do suspect that there could have been something more going on. But he recovered so well.
Tell me now, so what was the time that you started treating him? Are you still seeing him now, or is he completely rehabilitated? How long did it take, from the time that he had his fracture till the time that you were able to say he's good again?
So Teddy is no longer in rehab at all. He is 100% recovered, and he is walking around like he never had a fracture, which is, in my opinion, the perfect recovery, because you can't, if your dog's limping, it's sore. So that's great. So the journey, I mean, rehab started, early post-op, because we started with massage and light therapy and things like that, and then it took about 2 months to get him back to normal, and then towards end of 2 to 3 months he was fully recovered, and I discharged him from rehab. So it was a good 3 month journey. Yeah.
And great that you had such a great team and a very compliant owner.
Definitely.
That really, really does help. Now, Candice, your practice that you have in Joburg, you obviously treat lots of different cases. So this example that you've given us, Teddy, is a post-operative case after a fracture. What other types of conditions do you also treat? And just for the people that are listening, they might have a pet that might be able to benefit from the services.
So, absolute passion for me is the old arthritic dogs with hip dysplasia that have been struggling for months, and they recover so well. Actually, I've had another case, most of it's to me weighing 40 kgs, completely overweight Labrador, and he really struggled with a front limb lameness, and he lost the weight. He's on joint support. He's on a good rehab program, a maintenance rehab program, because he has hip dysplasia. And we call him Skinny Malinky because he's lost so much weight. He's moving easier. He's able to get up. He doesn't just sit at the bottom of the driveway anymore. The owner actually said to me that he has gained 2 years on him. So he's 2 years younger than he was before he met me.
Oh, that's awesome. In connection again.
Ah, there we go.
Can you hear me, Candice?
I think I'm back. Hi.
Can you hear me?
Yes.
Yeah. Okay, cool. So you also treat neurological cases, don't you? So dogs that have had disc prolapses, that are paralyzed. One of the things that rehab therapists do is actually teach dogs to walk again. So these are the kind of cases that people could possibly bring to you. Dogs with degenerative myelopathy. What other things? Anything else you can think about
I love that.
Can you hear me, Candice?
Yes, can you hear me? Hello? Hello?
Yeah.
So as I said, post-operative
I can hear you.
Yeah. Post-operative cases, osteoarthritic management. We do a lot of weight loss, a lot of knee injuries as well. Those are usually really successful. They have really good outcomes. As long as a good protocol is followed, and that, I don't think that rehab is a replacement for surgery. I think that the two work really well together. So I think, if you've got a ruptured ligament in your dog's knee, and surgery is recommended, then surgery is the way to go. And post-operative management will 100%.
I think we're struggling again with our audio a little bit. And Candice, thank you so much for sharing that case with us and letting everyone know all the wonderful work that you do there. So for those of you that are based in Johannesburg, you can get hold of Candice at Ramsay Rehab. Your website address, do you want to just tell us what that is? I think it's ramsayrehab.co.za, is that right?
Yeah, so it's ramsayrehab.com.
.com?
Yeah.
Okay.
And then...
I'll put it in the notes.
Perfect.
All right, great, Candice. Well, I think that you've got some patients that are just about coming to see you. So I know we squeezed this in your very busy day. So thank you so much. And we hope to have you on our Facebook page again, sharing some other cases. Maybe we can do the next one. We can chat about those dogs with a cruciate rupture.
Yeah, that would be great.
Had an operation and how you rehab them. That would be great.
Perfect. Thanks, Megan. Thanks for having me.
Is anyone who's on live, do you guys... So I just want to see if anyone's got any questions quickly. Does anyone have any questions? I haven't seen any comments come up. Guys, if you're watching this as a recording and you have questions about your dogs or Candice, please, you can just post them in the comment section and I will get Candice to answer them for you. So if any of you are wondering whether Candice can help your pet, you can just put a little comment in the questions box. All right, guys, nothing so far. So Candice, you can run off to your next patient. Thanks so much for your time.
Thanks.
And thanks everyone for coming on. Cheers
Thanks,
for now.
Megan.
Bye.
Bye.